1 second, sorry.
Okay.
We've started, Councillor Fairhurst.
Right, thank you, Adam. Right, good morning and welcome, everyone. We don't have any deputations, so we'll go on to agenda item 1, which is demand management and prevention grant awards, and that's Peter. So welcome, Peter. Over to you.
Thank you. This report is to make recommendations for approval by yourself as executive member to award the grants totalling £119,207 to cover a range of time periods between December 22 and March 2024 as part of the Local Solutions Fund. So Local Solutions Fund, as you're aware, is a kind of a strength-based approach which values local provision and seeks to enable them to further develop and be sustained and grow. The approach recognises that the county council is often not the only or the best source of help for local people, but actually that can be provided in their communities by voluntary and community sector organisations at that local level. Local solutions grants seek to fund projects which over time will reduce the demand as seen on Hampshire County Council statutory services and support participants to live healthy and independent lives for as long as possible. All of the local solutions applicants are expected to demonstrate how the project will be sustained in the long term beyond the life of the grant, and all do sign a statement within agreements should we award the grants to make it clear that this funding is only offered for this period alone. In terms of a lot of the work our officers do in terms of these grants is to look about how they can be sustained before they're funded. So looking at other avenues they could take, looking at other funding sources, if that's appropriate for later point or throughout the funding to enable that to happen. Some of these will also look for client contributions or from contribution from their members who benefit from the scheme, which they can then use to kind of sustain the scheme beyondwards. It depends on the model and the type of grant coming forward, but we're only looking to fund it as a startup. In terms of the services developed through the Local Solutions locally focused approach, they're all designed to enable early prevention support as well as shaping options which may be attractive to some traditional services available for individuals, carers and families. Some of the grants are more specific on what is being asked to be delivered, and others outline more generally the focus of the change required. Across all, it will be looked for the successful applicant in terms of the grants to ensure local insight and expertise continue to shape and develop and support the services as they move forward to deliver positive outcomes. Local stakeholders and local adults health and care and community teams have been involved in the decision making to ensure the grants recommended meet their local community needs. In terms of the grants we're looking to award today, the 6 grants, I'll give a brief rundown of them. The first is 29,000 for New Forest Disability, which is looking to provide practical and emotional support for residents discharged from Leamington Hospital. And it's designed for upon discharge that make sure that the service users have a robust plan in place for transition back to independent living in their own homes, and collaboration with all sort of necessary community organisations to provide that best long-term support in that transitional phase and beyond. The second is the Vine Centre for £28,207 for a duration of 12 months. A project is delivering for isolated older adults at increased risk of formal social care intervention across districts of Hart and Rushmore. It's centred around the digital upskilling and support, with the project will both deliver online and face-to-face support to build people's confidence and support networks to ensure that they're empowered to reconnect to their communities. There will be a use of repurposed technology through the Vine Centre, which will provide first-time users to ensure that nobody is excluded from this service. Citizens Advice at Hart are seeking £27,000 for a duration of 12 to 16 months. And this award, should it be made, will be for a project which will enhance the current citizen advice offer in that area to create local support hubs and an outreach programme to residents who are housebound or with limited mobility to ensure that all residents are able to receive the support they require for benefits or any of those other sort of services which citizens advice can assist with. That service also is very similar to other services we have provided and funded in other parts of the county area to set those up. So this is kind of another of those streams. It's not that this is the only area to enable that to happen. Unity, the fourth grant, will be seeking for a recommendation of award of 24,000 for a duration of 18 months. And this project is centred around utilising pre-existing allotments, which will then look at we'll look to then support individuals over 75 plus with increased risk of requiring formal care, but equally looking to utilise other groups who may benefit to bring them together to reduce that loneliness and isolation to kind of to help move everyone forwards. And lastly, Community First are seeking 11,000 for 12 months for a project to be run with a coordinator and a team of volunteers to enable structured one-to-one sessions across a range of locations. These sessions are structured to provide practical solutions to barriers which participants have to living independently and safely in their own homes. It could range from various different things, from making sure they got money advice and linking with systems advice. It could include cooking. It's a range of different areas depending on that level of need and what that person requires. All of these grants that which we're seeking for award, that total, as I said, £119,207, are the payments are looking to be met. Subject to approval. The reports committed for the payment will remain within the agreed budget envelopes for this year and next year when the grants are required. In terms of the performance, a number of mechanisms are employed to make sure we successfully monitor these grants and alleviate any risks about the grant not being delivered. This includes nominating an officer who will liaise with this organisation throughout the life of the grant, both to ensure its performance and to monitor its spend and work with them on the evaluation of it, but equally to help them make sure they do move towards that sustainability beyond the life of the grant. And as I said before, all organisations do sign a grant declaration to make sure they accept the funding can be awarded for this grant period.
Super. Thanks, Peter. Fran, do you have any queries, questions?
No, I don't, Liz. I'm happy with those grants. I think they're all good projects to support our residents.
Yeah. Councillor Withers?
I'm very happy with them as well. I personally know the Vine charity and the good work that they do, offering 19 services. And for this one, I think it's very important that they receive this grant. And for all the grants, I think it's very wise that we've got a monitoring officer that will ensure that the grants throughout the period actually given is actually used correctly and good feedback to us on the sustainability of the service provided.
Thank you. Councillor Briggs.
Thank you. Yeah, I will happily support them all, but I've just got a question on one. You're using volunteers, you're relying heavily on volunteers for when people come out. So I just wondered where if you're using volunteers, where is the money going to? Who to?
So although we're using volunteers come still at a cost. They require coordination. There's training costs associated to make sure the volunteers have the appropriate skills to deliver those services. Equally, and so that's a lot of where that support goes is in the kind of coordination of those volunteers, which is usually done, and in this case, is done by a paid role.
Okay, that's great. And that will probably answer my last one, which is on Unity, because they said that hopefully it will go on to people being able to care for, to be carers, to give people respite. So again, I presume you will provide the training for that?
Yes.
Okay, that's good.
Well, we will not be providing training, but the organisation will be, and we'll work with them and coordinate with them to ensure that's appropriate.
Yes, because sort of the way it read, it was just that people would go on and be carers when it can't happen.
Yeah.
Okay. Thanks, Peter. That's all. Thank you.
Thank you. Right, Peter, I'm more than happy to approve the recommendations. And if I could also just say in passing, I was speaking to someone from the voluntary sector yesterday who was singing your praises,
Okay.
saying how helpful and useful you were to them in ensuring good outcomes. So thank you very much, and more than happy to approve.
Thank you.
Thank you, Peter. Right. Emma's not here, so who's doing the appointment? Adam, are you doing it? The next one, appointments to outside bodies.
Yes, I can take you through it quickly.
Mm-hmm.
So you'll see from the covering report, there's a couple of appointments for outside bodies due to be made. For the Hampshire Hospitals Foundation Trust, role of patient champion, and the Southern Health NHS Foundations Trust, the role of Hampshire County Council representative.
Thank you, Adam. Councillor Carpenter, I know that you're very happy to become a member on Southern Health. Is that correct?
I am. Thank you, Liz. I was just going to say that I'm very, if I am appointed, I'm very pleased to be appointed, and look forward to working with them, and hope that I'll be able to make a useful contribution, and in so doing also keeping the council informed of any developments at the trust, particularly that affect our services. So yes, I am delighted. Thank you very much.
Super. Thank you. No, thank you. You'll find it quite onerous, I think. So good luck. We do have someone to go on Hampshire Hospitals, but I'm afraid I've forgotten the gentleman's name. Graham, do you remember his name?
I have
Yes,
Chris
indeed,
Harrison here.
Sorry? Sorry, Adam, did you have his name?
Yeah, I've got Chris Harrison.
Yeah. I should say Graham and I met with Chris remotely, but actually full credit to him, because he lives in Gosport. And he's prepared to go all the way to Basingstoke for meetings and that. So I wish him. I'm more than happy to appoint him, and I wish him all the best. I think that's really tremendous.
If I could just add to that, Councillor Fairhurst, I think indeed when we met with Chris Harrison, really committed individual, and just in terms of his interest in antecedents. So Chris is himself disabled, but has a particular interest in access issues, and that's not only in terms of physical access, but it's the full gamut of access to services. We have been in communication with Hampshire Hospitals Foundation Trust to confirm the arrangements by which Chris will be able to fully participate. Unfortunately, whilst Hampshire Hospitals have been operating a mix of in-person and virtual attendance at our board meetings, they're now moving to in-person attendance. We've gone back to Chris and he's confirmed he's content to go into this role and will attend in person. But we're also hoping, of course, that he'll also be able to be active via virtual meetings outside of the usual board arrangements as well.
Yeah. Okay, so I'm very happy to appoint both those people and wish them both all the best in their roles. Thank you. Right, agenda item 3, is it? Yes. Before we go into this, and I'll ask Jess to go into it in a minute, can I just point out to members here that there is actually an exempt report part of this. So if you want to discuss or ask questions about the exempt report, can you just say that you want to do it? And once we've finished this bit, we will close the meeting and go into exempt session. We'll stop the recording and then talk about it if that's your wish. Okay. Right, Jess, over to you. Oh, sorry, Graham wants to say something first, but he's muted.
Sorry, just before Jess introduces the item, I just wanted to point out to you, Councillor Fairhurst, that Jess and I met with opposition members last Thursday, that's the 13th of October, in order to take them through the agenda for your decision day this morning. Whilst they were happy with items 1 and 2, there were some concerns expressed with regard to this item. Jess and I provided a full briefing in terms of the item, and we pointed out that this is a re-procurement and therefore, to all intents and purposes, is a continuation of a successful scheme that's been in operation for several years across the county, the previous decision having made in 2016. Though it is important to say that Councillor Taylor and Councillor Harrison were present for that opposition briefing meeting. They expressed the view individually and collectively that they would prefer to see this item subject to scrutiny through HASC before coming here. Jess and I committed, though, to send them further information in terms of detail relating to this item. That information has been sent. We've had an acknowledgement from Councillor Harrison of having received it. Councillor Taylor has come back with some further points of detail, which Jess has responded to in huge detail. Again, we had indication from Councillor Taylor that she wouldn't be able to attend the meeting this morning. We had no similar notification from Councillor Harrison. We also received an email subsequently to the opposition briefing from Councillor Dowden, again expressing a wish for matters to be considered at HASC. What I would say is we have, I believe, answered questions that were raised during the briefing session last week. I cannot, though, say categorically that in answering the questions and supplying a huge amount of detail through the additional information that Jess has supplied, the opposition members are content and happy and indeed have no further questions that they would want to raise. But we have attempted to ensure that we've had full disclosure of everything. The concerns initially raised, we believe, are not necessarily germane to this decision. It feels as though they're probably relevant to other accommodation-based provision, not a deregistration of learning disability care home settings. As I say, something that we've been successfully undertaking now for some considerable period of time. That's basically what I wanted to say. My own view is that I would want you to consider this decision on the matters before you this morning. But I did, for the record, want to set out the position of opposition members following the briefing last week. Thank you.
Thank you, Graham. Jess.
Thank you very much, Councillor Fairhurst. So the purpose of this paper, as Graham has intimated, is to re-procure the Hampshire Deregistration Partnership Register. This first came to executive member in July 2016, and essentially this will continue to be used to support providers to move from residential care to supported living. And supported living now, again, for several years in Hampshire has been a very important strategy to support people with learning disabilities. And indeed, nationally as a model, supported living is recognised as an exemplar. The people that this deregistration vehicle affects are people with severe learning disabilities. So they are people who already receive and will continue to receive significant support. So the vast majority of people require 24-hour care and will continue to require 24-hour care. And indeed, many of those people require one-to-one support for parts of the day, and indeed some of them require two-to-one support of the day. So I think it's important to set in context the kind of cohort of individuals that we are talking about. The procurement means for the provider that they are incentivised where this model works well for them and for individuals to take forward a consultation process with service users and involving carers. It's subject to Mental Capacity Act statutory requirements. is carefully monitored by CQC, and indeed CQC are the people who finally decide whether a due process has been followed, and the main focus of their a decision is whether or not all of those service users' lives will improve as a result of the deregistration. The reason why supported living is regarded as such a good model of support to move to is to do with security of tenure. So within residential care, the government regards residential care as an unsettled accommodation, and that's because with very little notice period, as little as a month in some situations, people can be given notice for no reason related to them and can have care and accommodation removed. With supported living, that people have the same tenancy rights as would anyone would who is a tenant of a housing association. It's important to make the point that the vast majority of housing related providers in this scenario are registered housing providers who are specialists in working with people with learning disability, and actually in practice, as part of our diligence around providing evidence around people that we've already worked with during this, as part of this deregistration scheme, we looked at 9 properties where the deregistration had occurred, and the vast majority of those properties are large, fairly large anyway, supported living care and support providers who have a separate housing association within the learning disability specialism who support individuals with housing. So those housing associations not only have the same value base as you and I would want them to have in terms of supporting this group, they're also very experienced in working with people who quite often don't have capacity to be able to make decisions themselves and need full support with their tenancy. So I think this is something that that we have been doing. Absolutely, it means that people at the end of this process are in a supported living model of support. As you know, it's a tried and tested model in Hampshire. We have 700 people who are supported in supported living as we speak, and for several years through the provision of younger adults extra care and other bespoke schemes, we have been taking forward that model, and I'm certainly very proud of the outcomes that people experience as a result of that strategic choice that Hampshire have made for people with learning disabilities. So then that's just a bit of contextual information for you. Then thinking just a little bit more around the paper, the other impact, so many advantages beyond security of tenure in terms of financial benefit for the individual, a more personalised model of care, but also some organisational benefits. So although not a major part of why we are doing this, and certainly deregistration has a fairly minor part to play within this, it is all part of our transformation strategy. And because of the nature of the model, it not only can make some residential care services from a provider perspective more sustainable, as we can see from looking into the deregistrations that we have taken forward, it can also support the council in our financial strategy. So in combination, this deregistration, the work that we've done in younger adults extra care and work to move people to supported living has achieved fairly significant saving, whilst absolutely doing the right thing by people with learning disabilities and improving outcomes for them. So in that sense, from our perspective, it's a win-win-win. We have a procurement method outside of this called HADSOM, which is the way that we contract our care and support, and basically all of the detail within this bespoke procurement would mirror that supported living set of contractual requirements. And so, for example, if a provider, which is very unlikely, would want to end the care and support that they provide within this model, then they would need to give at least 6 months notice, and we would work to ensure that there is no gap in care and support for those individuals. And certainly we have had to do that on occasion, and we would do that. The great thing about supported living is that, of course, that provider wouldn't necessarily lose their accommodation at the same time, whereas when a residential provider again, this has happened, although it is rare, closes a service, the person also loses their accommodation at the same time. We want to modify the nature of the procurement model a little to incentivise providers a little more. So we want to increase the number of the number of years that this procurement method works for, to provide stability and sustainability for the provider, because otherwise that might be a barrier to the provider. So that's something that we are changing as a result of this procurement. Graham has referred to an exempt appendix that really is around procurement and the legal aspects of that, rather than anything pertaining to people with learning disabilities or outcomes per se. So that's important to note, and is standard. I'd like to point out that we have had a full equalities impact assessment, and we regard all of the changes here, and this is not a new thing, so from our track record and experience in deregistering services, we regard these proposals as neutral for the individuals concerned, and don't have any concerns or risks with regard to impact in any area with regard to the equalities impact assessment, and I'd like that to be clear too. So in summary, the recommendations to the Executive Member for Adult Services and Public Health are to approve the reprocurement of a bespoke procurement vehicle for the facilitation of deregistration or reprovision of younger adults residential care, and this will be with a maximum duration of 8 years on a 4x4 years basis, and also to approve a spend of up to £2 million under the procurement vehicle. It's important to make the point that that is only a proportion of our residential care settings expenditure, and it is not new expense. This is existing expense that we already have within that residential care domain. In terms of future plans, we would be looking to deregister up to 20 new schemes over the next couple of years. So not an enormous ambition there, but just creates that sort of option for individuals and service users and providers who think that they can improve the service they are managing through this vehicle. Thank you.
Thank you, Jess. That was a very detailed response and explanation. I've always been in favour of this because I've seen the results and how much better life is for people with learning disabilities. The only proviso I'd put, because one of the opposition members said they had concerns about certain places, I do wish they'd report them to us as soon as they get a complaint or something that we could look at it straight away, rather than let it just sit and fester in a way, and I would say to all councillors, if they have concerns, come and speak to us, so we can do something. Yeah.
Thank you. I agree, Councillor Fairhurst, that's helpful. I just wanted to mention that we have looked into on our recording system, because obviously one person can't hold all of the experience in their head, the outcomes from those 9 those deregistrations, and certainly all of them that we can see are benign, and we can't see any evidence of problems for individuals for those services. So I do wonder whether the concerns pertain to different services. So we do have a really wide range of supported accommodation in Hampshire, with varying degrees of adult services involvement depending on the ability and care group. And so it could be, and I don't know, but I'm pleased there might be issues, but perhaps not in, as far as I can see, absolutely not in these services.
Yeah, no, I would agree. And I was very pleased to see that we'd made an offer if people wanted to visit, that they could do so, just to see the benefits of the system for residents. Councillor Carpenter.
Thank you, Councillor Fairhurst. I think the main thing that Jess has said there is that it's a proven model, and Hampshire have looked at how people have fared in these situations before, and they've done well. And also from the Learning Disability Partnership perspective as well, you know, I've seen the benefits of independent living on people. I mean, I speak to the people all the time who are very happy in their situation. And of course, it has to be right for the person. But generally, I'm very happy to support.
Thank you. Councillor Withers.
I likewise endorse all the recommendations there. I mean, the proof in the pudding is the fact that the CQC monitor and totally approve all the processes that deregistration goes through and monitor it. And as such, it means that they fully approve the support given to these people with long-term severe learning difficulties. And I think also the fact that you review the bespoke contract to enhance the facilities and the services that the providers can provide to the individuals demonstrates proof from the county that we take this matter very seriously. It is a well-proven system, and financially it's something within our budget we must continue to support and develop. Fully endorse.
Thank you. Councillor Briggs.
Thank you. Not much more to add, really. I totally agree with Councillor Carpenter and Councillor Withers. My opinion is that we're doing all that we can for people with difficulties in living to lead a more normal life. And I don't think we can do anything better than that. The one thing I liked in the report that it did say with one person with mental incapacity and not any relatives, that we put an independent person in to help them to review. So no, thoroughly endorse this. I think I'm just looking at it that it's better for the people.
Absolutely. Thank you, Councillor Briggs. Okay, Jess, very happy to approve the recommendations, and thank you for all your time and work on this.
Thank you.
I'm sure we've got a lot of grateful residents out there. Okay, now does anybody want to go into exempt session, or are we all quite happy? You're all happy. Sorry.
Yeah, the report was
everybody's
very,
nodding.
no, the report was very, very clear on what's happening. Thank you.
Thank you. Right, I think that's it then. So Adam, do you want to stop the recording?
Yes, I'll confirm as soon as that's done.
Mm-hmm.